Welcome to all of you tuning in. We are about ready to start the last session of the day, a timely presentation on the opioid crisis. A couple of reminders. We will be sending an email with links to the presentations in the next day or so keep an eye out for that. And we are taking questions at the end of the session, so please don't hesitate to ask a question or two using the questions tab located at the top of your screen. If we don't get to your question, you can send an email to webinar@neo4j.com and we'll get you pointed in the right direction. And lastly, you can tweet about today's connections using hashtag Neo4j. Without further delay, I'll hand the floor over to Lance Walter, Chief Marketing Officer at Neo4j, to introduce today's final speaker.
All right, well, we're excited to take you through another demonstration, this time revealing hidden patterns in healthcare data using graph analytics, using the data from the opioid crisis. Cynthia Famano has been with Neo4j for a little more than a year as a senior systems engineer. She's got really deep experience in enterprise data management. She's held solution architect roles at companies like HP Enterprise and Teradata, including more than a decade at Sybase. Cynthia's got a master's degree in computer science from Johns Hopkins University, and she's going to use the lens of the opioid crisis to demonstrate the power of graph analytics. So should be a great session to wrap up the day. Welcome, Cynthia.
Thank you, Lance. I'm so happy to be here today to talk about how we can reveal hidden patterns in healthcare data using graph technology. You know, the opioid crisis has taken a back seat lately to COVID-19, but the problem is there. It's real. It still exists, and maybe even intensified as of late due to the fact that people are stuck at home, maybe lost their jobs, and maybe undergoing depression. All these things can lead to drug addiction. So it's a very pertinent topic, and I'm happy to talk about it with you today. I'm going to go into the presentation now. The numbers tell the story. The topic has been overshadowed of late by COVID-19, but it's still one of the most serious and costly issues that our country is facing. Although initiatives have taken place in many states and some progress is being made in the past few years, the numbers are still overwhelming, as you can see. While COVID-19 kills mainly the elderly, all age groups are targeted in this crisis, from the young athlete suffering a sports injury to those with rheumatoid arthritis, back pain, to recovering cancer patients. Doctors and pharma companies, driven by greed, are overprescribing and overdosing their patients, destroying their lives as they become addicted to these painkillers. We all pay for this as a result of insurance fraud and productivity losses in the workplace. This chart from the CDC shows the growth in the number of opioid overdoses over the past 20 years. Particularly notable is the increase in the death rate from overdoses of synthetic opioids from 2013 until the present time. Synthetic opioids are drugs like fentanyl and tramadol. Of particular concern is fentanyl. Fentanyl is 50 to 100 times more potent than morphine. It is highly addictive, a synthetic opioid that has been approved by the FDA for use in terminal cancer patients for the treatment of breakthrough cancer pain. Breakthrough cancer pain is pain that cannot be addressed through traditional methods like morphine. And it's really this intense pain that terminal cancer patients endure. And fentanyl was meant to be used for that. Unfortunately, doctors at pain clinics are prescribing fentanyl for other reasons, non-cancer related reasons like perhaps migraines, back pain, arthritis, and people are becoming dependent on the drug. And this is causing them to move to higher and sometimes fatal doses. The bar chart on the right is from a study done of certain states showing the number of overdose fatalities based on synthetic opioids between the years 2010 and 2015. Interesting to note, states like West Virginia, Ohio, and Maine showing almost an exponential increase in the death rate. In fact, as early as 2001, synthetic opioids were being prescribed for uses that were not FDA approved. Off-label marketing schemes are schemes to persuade doctors to prescribe the drugs for uses other than what is specified on the package insert or label, or maybe prescribing larger doses than what's recommended. This practice is technically illegal. However, physicians have the power to write these scripts and can be lucratively rewarded by the pharma companies for doing so. In 2008, the drug manufacturer Cephalon was indicted for off-label marketing and was fined $425 million for this. However, that amount of money is really just a drop in the bucket compared to what they were making. In fact, that was maybe a quarter of the 1 year's revenue. Eventually, Cephalon was sold for $6.8 billion. This chart shows a report that was done by the Office of Inspector General on Medicare Part D, showing the impact that opioid abuse is having on the Medicare program, not only to the health of the individuals subscribing to Medicare, but also to the cost of providing opioids to patients who really shouldn't be using them in the first place, and then become addicted. The study shows us that 1 in 3 Medicare Part D beneficiaries have received an opioid prescription in the year 2016. About 500,000 beneficiaries received what they consider to be high amounts of opioids. And 90,000 beneficiaries are determined to be at serious risk, which means they received extreme amounts of opioids and appeared to be doctor shopping in order to get their hands on more. The study also found about 400 of the prescribers had questionable prescribing patterns and were putting their beneficiaries at serious risk. So this brings to light several questions. How might we be able to track down the sources and causes of the opioid epidemic? Who is it that's doing the overprescribing and why? And are some parts of the country more susceptible to opioid abuse than others? So in order to answer our questions, we use the following analysis method. We decided that we were going to go look for some public domain databases that were openly available. So nothing proprietary was used in this study. And then we wanted to connect these disparate data sets into a graph using common attributes, for example, the national provider IDs or the national drug codes, or even geolocations. Then we were going to use a combination of Cypher queries and a graph visualization tool, for example, Neo4j Bloom, to try to derive insights from this data. So we chose to use Neo4j, which is a labeled property graph, and we determined is the best platform to effectively answer our questions. Storing data as a graph allows us to connect the disparate data sets using the common fields and to efficiently and effectively traverse these connections when querying the data. Because we are using a property graph, we can also store attributes associated with each connected node. For example, the open payment record contains the payment amount and a textual payment type, which explains the intent the money was earmarked for, whether it be meals, entertainment, speaking fees, or consulting fees. So we created this kind of experiment in August of 2019. And we did it for a conference called the Medicaid Enterprise Systems Conference, also known as MESC. Our premise was to determine whether payments that physicians and teaching hospitals were receiving from the pharma companies were in any way influencing the way they were prescribing opioid class drugs. We also wanted to take a look at the supply chain and connect the same physicians to maybe a physical distribution of the controlled substances. So the first data set is an open data set that we used is called the CMS Open Payments data. We used data from the years 2013 to 2015 because this is kind of the beginning of that curve when this synthetic opioid explosion started happening. So that equated to about 27 million records of open payments data. This includes all payments that were made by any pharma company to any doctor or teaching hospital in those years related to any drug, so opioid and non-opioid drugs. The second data set we used was the Medicare Part D prescriber data. We chose this because it was representative of scripts that were being written by physicians. So we know that it's not inclusive because there's also Medicaid, there's also private insurance, but this kind of gives us a representation of the prescribing patterns of the doctors. We chose the same years, 2013 to 2015, and we had 72.3 million aggregate records. And what I mean by aggregate is each record shows the amount of pills prescribed for a certain drug in a certain year by a certain prescriber. So this data is not down to the detail level of the individual prescriptions, but it's giving us an idea in general of prescribing patterns. The third data set we used is the DEA ARCOS data set. ARCOS is a data set that was obtained by the Washington Post through the Freedom of Information Act. And it is down to the transaction level of every controlled substance drug transaction that takes place is logged in ARCOS. If you've ever gone to a pharmacy to get a controlled drug, you'll note that all this is logged, every transaction. And so the Washington Post was able to get a download of this data from 2006 to 2012. Although it doesn't line up with the years that we used for the other data, we loaded it just to see, what kind of patterns, supply chain patterns were happening in regards to controlled substances, in particular opioids. Other data that we used, open data sets that we used were the NPPS National Provider Registry and the FDA National Drug Code Directory. This is the schema for our graph. Note the connections that tie payments to providers and hospitals. The providers are then connected to Medicare Part D prescriptions. And ARCOS transactions are also connected to what we call buyers. A buyer could be a pharmacy or a physician that distributes the drugs. And all these are tied together in some respect by location. Once we loaded the data, we decided to run some sort of BI type queries to get an idea of what was happening in respect to the opioid class drugs. So the first query that we ran was to determine, of the opioid class drugs, which one was involved or associated with the highest number of open payments. And so we ran the query that follows the graph connection between the medical drug and the open payment record, and then did a sum on the number of payments and the total amount paid. And from this, we determined that Subsys was the top opioid drug that was subject of open payments and the highest total amount, which was about $16.3 million. Another BI type query that we ran shows us, we're looking at the physicians this time. And we wanted to know, of the physicians, which were the ones that were received the most payments in respect to opioid class drugs, and also which ones were prescribing the most pills. So we ran this query that connects the physicians, the payments, and the Medicare Part D prescriptions. And we ordered them by the highest sum of payments. And this is what we came up with. So this is kind of showing us there's some doctors receiving extraordinary amounts of payments and also seem to be prescribing quite a bit of the drug Subsys. Again, Subsys is the one that's ranking on the top here for open payments between the physicians. Now, BI queries can be run from a graph database and also can be run through common tools, BI tools such as Tableau. So here is showing just a Tableau chart that was generated by querying the graph database using the Neo4j BI connector. So very similar to you would run a BI query against a relational database. You can also run them against graph database. The graph database is going to be more efficient because it's going to be more effective, especially when you're connecting a lot of data and joining a lot of data. But some people like to visualize things this way. So this chart is showing, I think, the doctors that had the highest prescriber rate and payment rate for a certain opioid, I think Oxycontin. So back to Subsys. What exactly is Subsys? Subsys is a sublingual version of fentanyl that is intended to treat breakthrough cancer pain. It is extremely powerful and also meant only for use by terminal cancer patients who have become tolerant of other opioid pain-killing drugs, and so they're still having intense pain. Note that on the bottom of this page, there's the bankruptcy notice. So at the time, in June of 2019, which was before we did the presentation, they were seeking relief under Insys Therapeutics, the maker of Subsys, was seeking relief under Chapter 11 for bankruptcy. They ended up through the Delaware bankruptcy judge and cleared the sale of fentanyl to another pharma manufacturer. So in the end, they did sell off Subsys. The deal netted Insys about $20 million in royalties. Let's look at the doctors that came up on the top of our list for the ones that are receiving the most payments and prescribing large amounts of Subsys. The doctors have one thing in common. They're mostly all either anesthesiologists or pain clinic doctors. We sometimes call these people the pill mills. So these are the doctors that that you go to for pain management, and these are the ones who are most likely to be prescribing pain medications to people that it shouldn't really be receiving them. So as I said, we did this in August of 2019. So a lot of developments happened since then. One development was that Dr. Gordon Friedman was convicted in Manhattan federal court for accepting bribes and kickbacks from Insys. But a lot of these guys are still practicing. Stephen Chun is out of Sarasota, Florida, and he was, a claim was filed against him for Medicaid fraud or Medicare fraud, where he was charging Medicare for intensive examinations when all he was doing really was that people were coming in and he was handing them a prescription. His fine was $750 million, but he paid the fine and kept practicing. So this gives you an idea of like how much money these people are making, not only in the services they're providing, but the kickbacks that they're getting from the pharma companies. So the fact that he could pay that fine and stay in business. So next I'm going to show you a demo. On the screen here, you'll see what is known as Neo4j Bloom. Neo4j Bloom is a visualization tool that can be used to kind of search through a graph using more or less natural language. And on the screen here, you see the yellow circle is the record for, or the node for Stephen Chun. And you can see the open payment that he's associated with for compensation for speaker fees, largely being compensated. And then you can see the relationships between that and the pharma company Insys that was providing the drug. So I'm going to share my screen now. And take you through a little bit of a demo. On my screen right now, this is our Neo4j browser. And it's connected to Neo4j 4.0 and my opioid database. I have a saved query here that I showed you earlier in the slide that ranks the opioid drugs in order of the ones with the most open payments. So that's one way to query our graph, is to use the Cypher language, which is pretty intuitive to follow the connections within the graph. And in this case, what I did was I'm aggregating a number of payments and the total amount paid, and I can display that in a tabular format. Another way to visualize this data is to use a tool called Neo4j Bloom, which I'm going to log into. Neo4j Bloom gives you a way to look at the data without having to write Cypher commands. So for example, it's more of like a natural language type tool. And you can also create saved searches. So you'll see here that I've created a few saved searches. And within the saved searches, you will see the actual Cypher language command that I'm running, along with the parameters that I'm passing to that command. So this makes it easier for end users, such as analysts, to kind of self-serve themselves by looking at the data using your saved queries or also natural language type queries in the search bar. So first of all, let's look at Stephen Chun. His provider ID is 177180. And there is Stephen. When I look at the neighbors of Stephen, now these are the nodes that are directly connected to him in the graph. I can see that his provider specialty, that he is an allopathic or osteopathic physician specializing in pain medication. I can see the locations that he works out of, which are mostly based around the Sarasota, Florida area. And I can see that he has quite a few open payment records associated with him for various amounts. Some of these are just for maybe meals or incidentals, but some of them are rather large. So we're seeing, for example, this open payment in 2013, where Stephen Chun was paid $7,200 for this compensation for services other than consulting. So this is kind of in the CMS open payments world, this is kind of a bucket category for bribes. I mean, it's really like the handoff of money to a physician for really maybe speaking to his peers, but maybe, you know, not doing much of anything except writing more prescriptions. If we look at the neighbors to this, we can see that that payment was made by Insys Therapeutics. And we can see that the drug associated with that payment is Subsys. And if we want to see the Subsys prescriptions for Dr. Chun, we can see those also in the graph. So these are the Medicare Part D prescriptions that he wrote for Subsys. And this is the number of days supplied. And these are annual aggregated totals. So this kind of gives us a picture of Dr. Chun and, you know, how much relatively he's getting paid. And we know that he's prescribing quite a bit of the drug Subsys. I'm going to clear my screen I'm going to run another query that's going to show maybe a bigger picture. So say, for example, I want to look at all the large subsist payments for a particular state. And these are payments that are in excess of $1,000. And I'd like to look at Massachusetts. So see how quickly that comes back with a visualization of the large open payments. So if I click on any of these, I'm going to see that they're above $1,000. And I can quickly point out which physicians within the state of Massachusetts are getting these large payments. I also note that these two physicians, Edward Migna and Imam Akbik, share a location. So that's interesting that they're working out of the same office. So that's how the pharma companies were working. They wanted, they would kind of recruit one physician, and then through that physician, then they would go and try to recruit the colleagues of that physician. So let me clear my screen, and now I'm going to take a look at the ARCOS data. In order to do this, I'm changing my perspective. So I actually created two different perspectives, one with my CMS open payments queries, and another perspective for the ARCOS data. And you can see I have some saved searches here on the ARCOS. So I haven't done much work yet on combining the CMS open payments with the ARCOS, although I have found some physicians that were distributing opioids in ARCOS that also were in CMS open payments. So it's my hope to eventually better connect these two. So here I'm going to run a query that is going to show me for that same state, Massachusetts. I'm going to look at opioid distribution by practitioners. So I'm looking at the distribution of opioids, not from individual pharmacies, but from the practitioners themselves in the state of Massachusetts. So this is looking through a much larger amount of data. As we said before, the ARCOS data is transactional, so it's very large. And we can see by the visualization that there are certain physicians that seem to be doing a lot of the transactions. They show up as these clusters. And this one in particular, his name is Agilius Spearings. He's one of the people that I noted that I also have a CMS open payments information on him. So he's one of the doctors that is getting paid by INSYS to distribute subsys. But in this case, our ARCOS data is not really for subsys. It is the data from the Washington Post is really showing us distribution of other opioids, non-synthetic. But still, we know that if a person is distributing one kind of opioid, they're probably distributing other opioids. Okay, so now I want to show you one other ARCOS query. And this one will show us distribution within a county. So remember I said that we had geocoded everything. So I'll look at a particular county, for example, let's look at Adams County in Colorado. This again is quickly going through that massive amount of ARCOS data in the graph and showing us a cluster of ARCOS transactions centered around this one pharmacy. And if I look at the neighbors for this node, I can look at the location and I can see exactly which pharmacy this is. So it's in Albertsons, doing business as a Save-On Pharmacy, number 888 in Aurora, Colorado. So this is showing us just how graphs can make it easy for us to kind of see what's going on in the data. I'm going to go back to my slides now. I just wanted to mention how we did kind of, just regular analytic type queries in this demo, but there's also a lot further that you can take graph analytics by going and using more data science-y type algorithms. In particular, for this type of data, centrality is a good algorithm to use, because especially if we had more data on the relationships between the doctors themselves, for example, if they were in the same associations or went to the same medical school or associated with the same hospitals, and we can kind of see how doctors could be influential to other doctors in bringing them on board to this program. Another algorithm or a data science algorithm that could be used here is a community detection algorithm to kind of see how like patterns cluster with each other. And you might even be able to do some link prediction, showing that if one doctor is prescribing a lot of opioids, then which one of his colleagues might be the next to do that. So it's almost doing like a predictive analytics. So now that we've looked at the data, I found it very interesting that on June 21st, 60 Minutes aired a segment on INSYS, an investigation and a court hearing for INSYS about how they have bribed physicians in order to push the drug Subsys. So it's very current that this 60 Minutes presentation occurred right before my presentation here to you. So I would like at this time, maybe we'll watch like a couple quick segments from that presentation.
When Alec Berlikoff and former Cephalon sales reps found a new home in 2012, working for a pharmaceutical mogul named John Kapoor, they would rack up huge profits selling Subsys, a new formulation of fentanyl. Like Actique, it was FDA approved for cancer pain only. And on the strength of Subsys sales, Kapoor's company became a Wall Street sensation, one fueled by unbelievable greed and depravity. In the midst of the deadly epidemic, INSYS sales reps got doctors to prescribe opioids for unapproved uses, enticing them with all expenses paid visits to strip clubs, fancy dinners, and with money, which federal prosecutors say corrupted the practice of medicine. This time, there would be no settlement. INSYS was targeted as an organized criminal enterprise, and its top executives were prosecuted.
So as we're seeing here, that finally, and this is just something that happened in January of 2020, finally, we're doing something about this. That in the past, pharma companies were just paying fines, which were just kind of a cost of doing business. Now they're taking it more seriously, and this is a good thing. So John Kapoor, the founder of Insys Therapeutics, was indeed sentenced to 66 months in federal prison for the scheme of bribing physicians to prescribe more Subsys. Alec Brolikoff was the chief sales manager at Insys Therapeutics. Alec had a history of working in sales for pharmaceutical companies and was a past employee of Cephalon. So he had a lot of experience of pushing these kind of opioid drugs to physicians. So let's listen to, so Alec actually pled guilty and was one of the key witnesses in the case. And let's listen to a segment of his interview on 60 Minutes.
Or hired Alec Brolikoff after the salesman regaled him with stories from his days at Cephalon, bribing doctors, he said, paying them for speaking engagements.
He pounded the table and he said, "That's our next VP of sales."
Kapoor asked him to start a similar speaker program at Insys.
I felt like I finally made it to the big leagues.
And John Kapoor was asking you to do this.
Yes, he wanted me to pay doctors to prescribe Subsys. I could do that. I've done it before. I can do it again.
And you had talked about bribery.
Oh, yeah.
Use that word.
If I think that he's going to be intimidated by the word bribery or that he hasn't been involved in that before on numerous occasions, I'm a fool.
So if you're interested in this topic, I highly suggest listening to the entire segment from 60 Minutes. It's very, it can be very disturbing. It's very revealing about what was going on. And the interesting thing to me was that, I created this data set or this graph in August of 2019. I spent a little time writing a couple Cypher queries, and it led me right to Insys. So now seeing this come up on 60 Minutes, the presentation, I guess, was delayed because of the more news around COVID. But in January of 2020, finally the convictions were happening with this white collar crime, whereas before it was kind of shunned. So this is a good step forward in the attack of this issue. So in summary, well, there's data that exists, a lot of data around healthcare, and a lot of data around prescriptions, and distribution of controlled substances. This data is huge, and you need a kind of a powerful method to be able to query it. But Graph gives you that, because Graph, you can easily follow connections in a native kind of way that makes it very quick, as you saw in the demo, to kind of go through large amounts of this information and to determine patterns. There's a network of influence between these doctors, teaching hospitals, and pharma companies. And by using graph algorithms, we can more easily reveal the patterns in this huge amount of data. by like kind of looking for the needle in the haystack. And I think, we can reveal what's actually going on, and maybe in the future to be able to act more quickly to resolve these. And then also we can use graph analytics to kind of look at any supply chain, but in particular, some of these opioid drug supply chains, and tie that with demographic data to find geographic areas that are most at risk, and to help us pinpoint our efforts into concentrating on the problem in those areas. So that's my presentation for today. At this point, if there are any questions, I'm happy to answer. And I thank you so much for listening today.
Hi, Cynthia, it's Marilee. Thank you so much. I mean, that was such an eye-opening and timely presentation. It's just amazing how you can really see the connections through this myriad of nefarious activity through a graph database. I mean, it just really brings it to life.
Yeah, thank you, Marilee. I agree.
For those of you in the audience who have questions, we have had some come in throughout the presentation, and we'll take a few of those in a minute, but go ahead and submit your questions using the questions tab on your control panel. If we don't get to your question, because I know we're running tight on time, you can also always shoot an email to webinar@neo4j.com, and we'll make sure that your question gets put into the right hands. But like I said, we did have a few come in, so let's start with a couple of those. It says, let's see, what other graph algorithms might be interesting to run against the data?
Yeah, so I spoke a little bit to that in the presentation. So if I had some additional data, which I would love to incorporate into this graph, showing associations between different physicians and the fact that maybe they attend the same conferences, associations, and then kind of using a centrality or betweenness algorithm to see which physicians are most influential. Obviously, that information would probably be very valuable to the pharma companies, but it also is valuable to us who to kind of see who may be targeted in the recruitment here. So I would definitely look at any kind of centrality, influence, betweenness type data science algorithms.
Great, thank you. And let's see, here's another one. What type of compute resources did you use to host this graph?
So this graph was hosted on Neo4j 4.0, and we are running in AWS. And the AWS instance that we are using is of 16 core and 128 gigabyte of RAM. We're using a single Neo4j instance. We are not clustering here. So you can see that for the amount of data that we had, we didn't really need a huge amount of compute resources to do this.
Great, thank you. And here's one. It says that you mentioned perspectives during the demo. Can you talk a little bit more about what those are, and is there a limit to how many you can have?
Sure. Perspectives are something specific to Neo4j Bloom, which is the visualization tool that I used for the demo. So perspectives allow you to customize first the way that the data is visualized by using colors and icons. And something I didn't show you, but I wanted to show you, but I forgot, was that you can increase the size of the little circles for the node depending on values in the attributes. So for example, if I wanted to show open payments that were over $2,000, and I can make them appear larger on the screen so that when you have those visualizations that are very busy, the things kind of can pop out at you. So that's one thing you can use a perspective for, and the other thing is to contain your saved queries, and then you can use as many perspectives in Bloom as you want. So suppose you have different types of Bloom users that like to see the data in different ways depending on their personal preferences. You can tune that for the user. Maybe they want to see special icons or colors, or have it individualized for them.
And that sounds like a great customization tool.
Yeah, it is.
So I'm looking at the time, and it looks like we are just about out of time for today. Cynthia, I want to thank you again so much for your presentation. For those of you in the audience, thank you for joining us for this month's Connections event. Please stay tuned for the email tomorrow that should give you the links to the recordings and to the presentations. And then we will be hosting the next Connections in July featuring risk mitigation in the supply chain. So that'll be a great one to attend as well. So with that, I think I will bid you all a great day, and we look forward to having you at our next Connections. Thanks so much.